I want to tell you that tomorrow night we're going to be joined by Governor J.B. Pritzker of Illinois, who, among other things, has recently been involved in a pseudo-secret effort this week to fly chartered planes full of medical supplies into Illinois, basically under the radar, in order to tell you what's going to happen between now here in the warehouse. But yeah, it's been sort of dramatic.
And you're not saying which tarmac where, so okay, great.
Yeah, I have to say, I am terrible at keeping secrets. This is why I do TV shows and I don't work for any place that requires me to keep secrets. But yeah, if I knew, I would probably blurt it out. So I'm telling you everything I got.
Rachel, you've done a great job of keeping all of my secrets. Thank you very much, Rachel.
Thanks, Lawrence. Good night.
Well, today, Donald Trump was asked about protesters in Ohio who are protesting the Republican governor's stay-at-home order, and Donald Trump said, these were his words, "They seem to be protesters that like me." And that's true. There they are in their Trump hats, mouths wide open, breathing on each other, shoulder to shoulder. That image was captured by photojournalist Joshua Bickle for the Columbus Dispatch. Steve Schmidt, who has spent much of his adulthood trying to elect Republican presidents, wrote this about that picture. This Joshua Bickle photo is worthy of a Pulitzer. It absolutely and perfectly captures the whack jobbery of Trumpism and the grievance of people who have surrendered any vestige of common sense or normalcy to the altar of freak show politics and the dogmas of political cultism. Steve Schmidt will join us at the end of this hour on a day when Donald Trump's approval rating continues to sink and Joe Biden tweeted this picture of what Donald Trump is up against, a united Democratic Party with every Democratic candidate who ran against Joe Biden now endorsing Joe Biden. Predictions in this presidential campaign are dangerous. If you made a prediction a few months ago about what the number one issue in the presidential campaign would be, you would now be wrong because COVID-19 came along to change everything, including our politics. And so with minimal confidence, I offer this prediction. The number one issue for the presidential campaign in the fall and the debates that Donald Trump will probably refuse to participate in will be coronavirus testing. 5 days ago, Joe Biden tweeted this: President Trump needs to do everything in his power to expand the number of testing sites and surge the number of tests. Mass testing is key to reopening the economy and finding a way out of this crisis. There it is. Mass testing is key to reopening the economy and finding a way out of this crisis, and everyone agrees about that. That is the challenge of the presidential campaign. And Donald Trump seems terrified of that challenge, judging by his performance today. Donald Trump knows that 99% of the people watching his press briefing today, and that 99% of the people watching this program right now, and that 99% of the people in America have not been tested for coronavirus. And no one at the White House today was able to tell us when we will be tested. Donald Trump has already said there's no way we are ever going to test 100% of the population, but are we going to test 50%? 10%? No one at the White House dared to say a word about that today, even when they were specifically asked about it. We can thank Bob Costantini of Westwood One News Radio for asking the most important question of the day and clearly the most terrifying question to Donald Trump, because that question made Donald Trump shut down the briefing and get everyone out of the room and not take another question.
Do we have an idea of how many millions, tens of millions of tests they're going to need for them to get through these phases? Any number out there? A test of any sort?
How many tests are we going to need? Simple question. There's not a medical professional who comes on this network who's willing to not answer that question. They're all willing to answer it, and they say it's millions upon millions upon millions of tests. Tens of millions of tests are necessary. There's not a medical professional speaking outside of this White House or a serious governor who is not saying today that we are nowhere close to being able to do the amount of testing we need to make it safe for people to go back to work, to make it safe for students to go back to sleep in their dormitories at college. Dr. Deborah Birx handled that question for Donald Trump in the briefing, and she did not handle that question like a medical professional. She handled it like a lawyer representing Donald Trump, which is to say she handled that question like a lawyer representing a guilty client. And she simply refused to answer it. And like a good lawyer, Dr. Birx did not say, I refuse to answer your question. Instead, she delivered a long answer that deflected from the question without ever coming close to answering it. But she did use the word test several times so that she could pretend that the answer had something to do with the question. Here's the beginning of Dr. Birx's defense of the Trump administration's failure to test.
Yeah, so you've heard me talk about tests for a while from the podium, and I think what has happened over the last several weeks is hospitals and clinics that could move to the more point-of-care test, move to those point-of-care tests. And what it's left is an amazing array of capacity that exists in the country for at least 1 million more tests per week.
It was a very simple question. How many millions of tests are we going to need? The answer didn't even have to be a sentence. It just could have been a number, 100 million, 200 million, 50 million. Whatever the answer is a lot of million. But Dr. Birx rambled on and in deflection, telling us about the unit cost per test at some commercial testing companies. But she did eventually make this commitment, if you can call it that, on behalf of the Trump administration.
So we're committed to work with laboratories to answer every one of their issues with the state and local governments. So it's more of making sure that every governor and every public health official knows exactly where every lab is and where the tests are, so we can create with them a real understanding so all these tests can be run. So yes, there is twice the capacity right now.
In other words, nothing. The Trump administration is committed to doing absolutely nothing to get you tested. If you get tested, it is because your governor will get you tested. Or, as we heard last night, if you're lucky, someone in your state will volunteer to do what Sean Penn has organized in California around Los Angeles. Drive-through testing facilities are running in Los Angeles right now thanks to Sean Penn and the cooperation of the mayor of Los Angeles and the governor of California, and no thanks whatsoever to Donald Trump or to anyone working for Donald Trump. And Donald Trump clearly fears that he is going to be judged on the issue of testing, and so what a sane politician would do in a situation like that is not what Donald Trump chooses to do. California Governor Gavin Newsom and New York Governor Andrew Cuomo both believe that they will be judged on their ability to get people tested, and so they are working very, very hard to get people tested. That's not the Trump approach. Donald Trump believes that if people are going to judge him on testing, then he's just going to lie about testing. He's not going to do anything about it. He's just going to lie about it. And the big lie in today's White House briefing, which pretended to outline guidelines, just suggestions about how governors might or might not decide to reopen certain activities in their states. The big lie in that briefing was the lie of omission. The lie of omission about testing. Donald Trump and his task force tried to get through their briefing without talking about testing, which meant it was not a reality-based briefing. When Dr. Birx finished her evasive answer about how many millions of tests we will need, Donald Trump came back to the microphone for a minute to thank everyone involved in the briefing today and rushed everyone out of the room in record time. And this was not one of those 2-hour spectaculars. As soon as the questioning about testing got too uncomfortable, Donald Trump just shut that thing down. And because Donald Trump works stream of consciousness with no space whatsoever between his mind and his mouth. There are, every once in a while, those exquisite Trump moments where the truth accidentally slips into that stream of consciousness and comes out that mouth.
I'm not saying anything.
Let's just hear that one more time.
I'm not saying anything.
I'm not saying anything. Stream of consciousness is a very risky way for a politician to work because that can happen. I'm not saying anything. And that was so true of today's White House briefing in which Donald Trump said nothing real and once again left all of the burden and all of the responsibility for government's response to this pandemic on governors. And so we turn to one of the people who is in charge of trying to get millions of people tested in his state.
Now we have a chance to be more intelligent, frankly, about handling our healthcare system. Testing and tracing, testing and tracing, testing and tracing, and we need the federal government to work with us on that. And then phasing an economic return to the quote-unquote new normal, right? Those are all activities that are going on at the same time, and that's our plan to quote-unquote unpause New York.
Can't get the testing done without the federal government's help, without the federal government's leadership. New York numbers are still moving in the right direction tonight. In the last 24 hours, New York State has suffered 606 deaths. Today, Governor Cuomo announced a 1-month extension of his shutdown policy in New York, which he now says will be in place until at least May 15th.
We have to continue doing what we're doing. So 1 month, we'll continue to close down policies. What happens after then, I don't know. We will see, depending on what the data shows.
The United States now has 665,258 reported cases of coronavirus. And as of tonight, the United States has suffered 34,283 reported deaths from coronavirus. The grim numbers of this pandemic are also moving in the right direction in New Orleans. Dr. Najee Masri of Louisiana State University's hospital has been keeping a video diary for us of life and death in the emergency room in New Orleans.
Looking back a week ago, we had about 85% of our hospital that was COVID patients. Moving forward now, today, we have about 60% of our hospital that's COVID patients. People still having heart attacks. People are still having strokes. And remember, with the outpatient clinics being closed, they don't have access to preventative health. They don't have access to colonoscopies and the such. So we talk about the peak of coming up with COVID-19. There's going to be a second peak coming. It's a peak of those people who couldn't get that preventative health, and they're going to have those issues with their heart and their strokes and the different things. And we're going to be there for them just like we are for the COVID patients.
Dr. Dara Cass was there for them in the emergency room in New York City. Dr. Cass got infected with coronavirus while treating patients in New York City. Dr. Cass has now recovered and has gone back to work. Dr. Dara Cass will join us after this break, along with Laurie Garrett, who won a Pulitzer Prize covering global pandemics. Laurie Garrett has been studying this subject for years. She is the first person I heard talking about this subject who made me understand the enormity of what we are facing. When Laurie Garrett speaks, I take notes. She will join our discussion after this break. We have breaking news from House Speaker Nancy Pelosi, who issued this statement tonight about the guidelines the White House released today. Testing is the key to opening our country to resume our lives. The White House's vague and inconsistent document does nothing to make up for the president's failure to listen to the scientists and produce and distribute national rapid testing. Joining our discussion now are Dr. Dara Cass, an emergency medicine physician in New York City. She is also an associate professor of emergency medicine at Columbia University and a Yahoo News medical contributor. Laurie Garrett is with us, a Pulitzer Prize-winning reporter covering global pandemics. She is a former senior fellow for global health at the Council on Foreign Relations in New York. And Dr. Cass, you have recovered from coronavirus after treating patients with it. You've gone back to work now. We do seem to be seeing the grim statistics in New York, those still grim, moving in the right direction. What is your sense of where we are now in New York City and New York State?
So New York City is seeing the evidence and the work of the people of New York, seeing our numbers go down in both hospitalizations, and fortunately, finally seeing our number of deaths per day go down. But our hospitals are still at basically full capacity. We're still seeing so many critically ill patients, and we're still trying to take care of every single patient that comes in with the full scope of our practice. So although the numbers in New York are encouraging for the treatment of the first wave of people that got infected, probably between 2 and 3 weeks ago, we still have a lot of work to do and a lot of patients to take care of.
Lori Garrett, Donald Trump pretty much shut down the briefing and ran out of the room when a serious question about testing finally got asked. The specifics of how many millions of tests do we need in order for the country to be able to get back into some kind of working relationship with jobs, with students. The point that Joe Biden made, which is the way out of this is a massive amount of testing so we can tell where we are with the pandemic. What was your reaction to that big omission in the White House presentation today, where they basically said testing has nothing to do with us?
Well, Lawrence, I think they left out all metrics. It's not just They didn't talk about testing. They didn't give you anything empirical, anything at all. This report basically was a PowerPoint presentation of a pile of slides stuck in between paper. And the slides told you basically one thing that came through loud and clear. The federal government is not doing this. You personally are responsible. You employers are responsible. You states are responsible. Hey, you want to know how many people to test, when to test them, what kind of test, antibody or PCR, what should be the nature of the testing? Should you come up with strategic testing where you're targeting key population groups as indicators, or should you just randomly test just everybody in a Walmart parking lot, as was the original scheme? There's nothing in there that answers any of those questions.
Lori, what is the best answer to those questions?
Well, I don't think we're ever going to have in this wave of the epidemic, at any rate, 100 million, 200 million test kits. It's not going to happen. And look what just happened in the UK. Boris Johnson's government bought 20 million test kits from a Chinese manufacturer, and they turned out to be 100% fraudulent. And they just spent a pile of money for 20 million test kits. There's a lot of fraud. There's a lot of unintended error in the testing situation right now. What makes more sense is targeted testing, so that you set out a series of specific problems you're trying to answer. And you say, if we test this group, we'll know the answers for this population, this group, this population. You set up indicators. You're not going to have 100 million tests. So, for example, we should definitely be testing everybody who's in a nursing home in the United States of America today. That should be top priority. We should test anybody who comes in with pneumonia in a hospital in America today, top priority. But can we test every single school child in America before they set foot in a classroom? We won't have those tests, Lawrence. So we're going to have to come up with a smarter way to answer the question about how many of those school children in, say, the Bronx are infected. You have to come up with a carefully, scientifically designed test pool and, narrow the search down, but a smart search of 5,000 carefully selected individuals that gives you an indicator of what you're looking at for your whole community. It's the only way we're ever going to get there. There's never going to be a way that every employer can test every single employee with a valid test between now and July. Never going to happen.
Dr. Cass, what about testing in New York City hospitals, for example, medical personnel? What do you think the hospitals need in terms of testing and monitoring the medical personnel?
So the hospitals have they've really tried to ramp up their own testing internally, and that's why some of the tests come back in one day as opposed to the 3 to 5 days that happen in commercial labs. The issue a lot of times is the products, the reagents, the swabs. It's literally a long, skinny Q-tip, and if you can't get enough of them, you can't test your healthcare workforce. The other option is if you have to choose between sick, critically ill patients and the healthcare workforce, who do you choose to test? Because there's been, although we ramped up a huge number of tests in New York City, we haven't been able to keep up with the need. And we're certainly not testing healthcare workers to go back negative before they go back to the workforce. So we follow the CDC guidelines and say after 7 days, if your symptoms are better and you have no fever, you can go back to work with a mask. It's the same way the White House is recommending that non-essential workers go back now. And we know that it's not optimal to keep the disease at bay and stop the spread of infection amongst vulnerable people.
And Dr. Cass, the president said today at the briefing, one of the things he said was there's no problem with swabs, what you just identified as something that you don't have enough of supply of. He said there's absolutely no problem on the supply of these swabs all over the country. I've heard exactly the opposite from all over the country.
I know people waiting on reagents today to test more people tomorrow. So I appreciate what the president hears in his head, but I hear different things. And that really is that there is a limited capacity to test for healthcare workers, vulnerable people, scaling and, figuring out if children in New York City are infected. I have a son who had a liver transplant and goes to a New York City public school. It's going to take a lot of really deliberate testing to figure out if he can go back to school. These are the things I think about as a mother, as a physician, as a member of my community, about what would it look like to make my community safe again.
Lori Garrett, I've had one administrator at a university in the Northeast say that their plan, their hope, is to, in the fall, test every returning student to that university. You're saying it's extremely unlikely they'll be able to do that.
Well, we won't have the test kits, but also, it's not really going to be terribly helpful to know if John Jones tests positive or negative on Tuesday, because John Jones could get infected on Thursday. The problem is that we're all asking the wrong questions. It's not really going to be possible to say, I'm absolutely sure it's safe for John Jones to come back to University X. As I said, he could test negative on Monday, positive on Thursday. But yes, and by the way, he could have been infected both times and you got a false negative on your test. But what you do need to know as the administrator of a university or a school principal is, what's a random sample show me? What do I think I see in my community that gives me an indicator of whether or not it's safe to open these doors?
So basically, it's a medical version of polling.
Well, I would call it epidemiology, but you can call it polling.
Okay. For this hour, we'll call it polling. Lori Garrett, thank you once again. Really appreciate it. Dr. Dara Cass, thank you very much for joining us, and thank you for the work you're doing in New York. We all really appreciate it.
Thank you.
Thank you.
And when we come back, John Heilman will join us along with Congressman Dan Kildee of Michigan, where Trump supporters are now protesting the Democratic governor's order to stay at home. That's next.